to people of India. I'm really grateful to the work, to the team in WHO for having conducted this systematic study and offering us, in a way, quantitative estimate of what we all believe is the ultimate purpose and the goodness of the mission. So thank you very much for your support. Findings have been presented, reflections on the dais have been made. Clearly, we are witnessing the role of safe drinking water in terms of saving lives. We are also having a qualitative estimate of how it is empowering women and our girls, empowering families indeed, and how it is contributing toward productivity and economic ease. The ease of living is being enhanced. Lives are being saved. Productivity is being stimulated. Can there be any other mission which encompasses all these great elements that we all dream and aspire for? So it's really a heartwarming day for me. And I feel that the Department of Drinking Water and Sanitation is a noble department. What a department to be in. It's amazing. Public health dimension of water and sanitation is well known. In fact, public health science is based on the learnings of connect between hygiene and water and health, if you go back to history. And we are surely living in our times in seeing transformative changes in those determinants of health and disease. And both Rodrigo and Rajiv have eloquently described those elements. Let me pick on what impresses me the most. First, the scale and the speed. The 2S. And this comes from the Honorable Prime Minister's repeated thoughts that should, or repeated direction that should drive India's transformation in every sector. Scale. We're looking at a scale, we heard from ma'am, I'm just using those numbers. 90 million water connections have been implemented in a matter of 41 months. 90 million. When this mission is complete, we would have created connections to the tune of 16 crore, which is 160 million. Now what is that? That is the population of UK and Germany put together. Scale. We are doing it in 5 years. So that is a scale that amazes me, completely amazes me. And then I come to the speed. You heard from ma'am that there is one new water connection every second. Every second in this vast nation. And who says things don't work and things cannot happen? Now we have assigned 2 hours for this meeting. In 2 hours, 7,200 new connections would have been commissioned. And that would change the lives of a multiple of 4, 36,000 persons. 36,000 persons' lives will be very different after this 2 hours of our session. And if I add the lunch and the morning party which I missed, this number will be at least, what is it now? 10,000 connections, 11,000 connections, and 45,000 individuals will be benefiting. I don't know of any other program which can transform individual lives and lives of families and ease of living with that speed. What a speed. So big hand for the scale and the speed. So I'm truly honored to be here and to note that Jal Jeevan Mission's positive contribution to better health outcomes is visible to us. And I also want to quote the Honorable Prime Minister in this regard, who said that if Bharat can achieve the saturation in a social sector like drinking water, it becomes inspiration for other nations to follow. And indeed, you have heard how this would resonate in the world and how it resonated in the world in the previous mission, which again was so successfully implemented by the department here. It's transforming lives truly. Let me also now move to two other aspects which are highly laudable underpinnings of this program. Saturation. We are saying we'll finish the work. Done. It's not halfway house. It is not the MDG format, 2/3 reduction. No. No one shall be left behind. Therefore, the total spirit of the SDGs and the spirit of the saturation model of making sure that the scheme reach every person, last mile, every person standing in the queue, the last person standing in the queue. This is the mission that aims to achieve that. So saturation level achievement, no one left behind. The SDG spirit is truly a hallmark of this scheme, and it's great that we are witnessing successful achievement of the roadmap that has been envisioned. The point about standards, the fourth S, is extremely vital to the story. And that talks about quality. So it's not just saturation, but it's also saturation with quality meeting the standards. Standards that go beyond just fecal contamination, but also have the levels of metals and so on. It's remarkable. And I was very impressed, man. Rajiv and I, we were in Gurgaon Health and Wellness Centers in some village, and we found there was the best water testing test lying there, and they showed us. So it is, the testing system is penetrating. We're very impressed. This is truly impressive. Also, there are two other facets that I like to highlight. One, the community participation and the partnership. It shows us the success that we achieve when everybody comes together. It becomes a Jan Andolan. And again, that is the USP of the Prime Minister's program. Whether it is Poshan Abhiyan or Swachhata Mission or livelihoods and so on, always Jan Andolan is the enabler for the success of any large program. So let's not forget the COVID-19 pandemic, where it is national Jan Andolan that was able to achieve what we are able to achieve, to thwart the deaths, the misery, and above all, access and receive the vaccination during that phase. So Jan Andolan is another hallmark, and someday we must write about these, not only the impact, but also the learnings that are there in the space of community participation. Dr. Pahal talked about eliminating diarrhea deaths. And indeed, in that regard, the contribution of the Jal Jeevan Mission would be immense.